My name is Mike Dolan. I'm a hand and wrist microsurgeon in Jackson, Tennessee. I'm a partner at West Tennessee Bone and Joint Clinic. I have been doing exclusively upper extremity reconstructive surgery since 2009.
That's radial tunnel, and that's the radial nerve right there.
In this part of the world, in West Tennessee, we are surrounded by factories, and an upper extremity injury is a weekly occurrence. We are dealing with trauma of the hand every single day. That's where having a relationship with your prosthetist helps.
His arm has definitely changed a little bit.
Because every situation is different. When you have a prosthetist, you can call and say, hey, I have this patient, should I keep this length? Whenever I have a patient that needs a prosthesis that I want to refer to Arm Dynamics, they always come back happy. The quality of the work I've seen, the relationship I have with that facility, the ability for us to have a back and forth in a way that benefits the patient the most.
Right.
I don't need to look anywhere else. I've got what I know works.
My doctor, Mike Dolan, was right by choosing Arm Dynamics because they specialize. That's all they do. So when an upper limb surgeon directs you to somebody who just does upper limb, that's all I needed to know.
I want him to be able to get the best care with his prosthetics. And so it was well worth the travel. He's able to take his initial prosthesis home with him. It's fully functional and he can go back to work.
I will always go to Arm Dynamics. I'm not going anywhere else. They're like a family to me. With me being a bilateral amputee, I get that one-on-one care. Yay. They're not sidetracked with having another patient. They have just me in there, and the therapist works with me on how to use them on a day-to-day basis. I don't worry about the added expense of traveling because Workman's Comp does pay for my traveling back and forth. Going to Arm Dynamics makes me feel more comfortable about using prosthetics for the rest of my life.
Good boy.
I went to Arm Dynamics and everybody there was just perfect. There was a whole team of people there. We connected right away. I know the first day we were there, he immediately took the cast of my arm.
It took him 3 days basically to get his socket fitted.
And the fourth day we did all the testing.
And tweaking and all that. They made the whole process very comfortable. It was a good experience. We very much enjoyed it.
It really was. It was a good week.
I think that the data is extremely clear. When you have a upper extremity amputation, speed is of the essence. You get people back to work as quick as you can, and you get them fit as quick as you can, or their chances of being a lifelong prosthetic user goes down significantly. We've had several of the case managers or adjusters go, and they come back and they're like, oh, I gotcha. I understand why we're going there. You just don't ever hear anything negative, and you see what they come back with. And that's where I would send any of my family members without even thinking about it.